Okay, so to continue talking about the parents' influence on language development, um, in that really that communication between the parent and child really begins at birth and is really rooted in the interactions between the two of them, both sharing emotion and attention. So those critical times where the child is engaged with the parent in those activities of joint attention, that's again where the child is receiving critical language input from the parent and is learning language receptively and those critical interactions. And then this forms the foundation for emerging language in the child. So obviously, if a parent is overwhelmed by types of emotional stressors, different problems that are going on, causing a lot of stress, and not the parent's not able to provide appropriate language stimulation, interaction, and bonding with the child, um, then that could negatively affect that child's language development. Also, if a child here is not able to produce clear communicative signals, meaning that if a child is born with disabilities and is demonstrating significant communication delays from very early on, that also can affect the bonding relationship between the parent and the caregiver, then further possibly affecting language development in that child. So the causes for possible language disabilities and delays in young children can be divided into biological and environmental risk factors. So, biological can include congenital factors which can occur before or during birth. Um, Again, anything that would occur after birth would be postnatal, and any types of syndromes that the child is born with and/or disorders all fall into that biological category. The other risk factors, again, can include environmental, and that would again mean that the environment had an influence upon that child's potential to develop language normally, and that could include abuse and neglect, as I just mentioned earlier. If the child is not getting appropriate interactions from caregivers and having a bond with particular caregivers to learn language, that again could impact upon their communication development. So young children could demonstrate intellectual disabilities. And this is typically measured with IQ score. And here is an example of the range of different IQ scores that could indicate possible intellectual disabilities. However, with very young children who are not able to use IQ scores because they're not able to really engage in formal testing in order to measure that because of obviously their age and ability to attend to those types of tasks. So we really look at a child's developmental functioning and overall functioning and acquisition of developmental skills in order to globally look at their cognitive functioning and to see if they're at risk for an intellectual disability. So oftentimes, if a child has a developmental delay, language abilities are going to correspond to that. And we often look at a child's cognitive functioning and ability to acquire symbolic skills as a foundation to then further support acquisition of language. So again, remember that language is a symbol system, and a child needs to have adequate cognitive skills in order to adequately acquire that symbol system and or language system. So intellectual disabilities are often caused by biological factors. These could include genetic, chromosomal disorders, possibly maternal infections, toxins, or chemical agents that the child was exposed to, and possibly complications during pregnancy. So unfortunately, developmental language disorders are often not evident until a child is expected to begin the process of learning words, and then the parents and family often realize that the child is not speaking or using language like other children of the same age. So then that's often then where concerns are raised. Unfortunately, then that's usually around the age of 18 months, 2.5 sometimes, and a lot of time has gone by, and sometimes critical time has been missed when intervention and concerns are raised, as a child is an older toddler. So, again, normally developing children, their first words are typically nouns, and the names are usually objects and people that the child enjoys and interacts with. And phonologically, meaning the speech sounds that the child is using for these first words are usually simple, and these first words are usually 1 or 2 syllables, and they're easy to produce. So here I listed M and B. Those are the bilabial sounds, and those sounds are usually, again, produced first. They're easier to produce. And then sometimes children produce the D sound as well, an alveolar sound. When children are developing language, most children understand more, so they're understanding language receptively more than what they're able to produce expressively at first. So a child with a developmental language delay, obviously, like I said, around the 16 to 18 month mark, they may be slow to produce first words. And that's where it's possible a parent could start to have concerns about language development. They also may demonstrate delays in comprehension of single words and phrases. So when parents are speaking to their children, they're not really responding, they're not able to follow simple directions or indicate that they're understanding what is being spoken to them. And then as a child continues to get a little bit older, they continue to demonstrate difficulty with vocabulary development. So that's the area of content according to Bloom and Leahy. And so their vocabulary and the amount of words that they're using is slow to develop. And then because of that, if their single word vocabulary is smaller, then that's going to prevent them from progressing and using multiple word combinations when they're speaking. Also, speech production may be challenging, meaning that the amount and different speech sounds that the child is using to express themselves or produce words is more limited. So here that means, again, limited number of phonemes produced, meaning that the words that they do say may be missing critical speech sounds, and again, they may only have a handful of sounds that they can produce in a meaningful way. So as the child then begins to get older and entering the preschool years, the child with DLD, or developmental language delay, obviously is going to continue to demonstrate difficulties. So in preschool, normally developing children then start to produce longer and more complex utterances between now preschool 2 to 5 years, and that's really the age of between 3 and 5 is called the language boom in children, meaning that they really start to use language in more advanced ways, and they're really rapidly developing their vocabulary skills, and they're also then speaking in longer sentences or utterances in preschool. Also, during the preschool age, again, between typically 3 and 5, sometimes, again, a little bit more advanced children can start around 2, but the acquisition of now grammatical morphemes. So that's your word endings. Okay, so your endings such as ing, s, ed. Those use of those endings start to come in, okay, during the preschool years, and again, the child is working on developing more complex language structures. Okay, and here, by the time they enter kindergarten, or are age 5, most children are able to accurately produce most of all of our phonemes in the English language, and we see that articulation errors or phonological processing errors tend to diminish. Okay, so to just talk a little bit about autism spectrum disorder, or ASD. We do a separate topic on autism in a few weeks, but just to introduce briefly the disorder and to define the 3 major characteristics of the disorder, which includes impaired social interaction, impaired verbal and nonverbal behavior, and demonstrating some type of repetitive movement, ritualistic behavior, or abnormal preoccupations with objects or things, and a resistance to change. Again, autism spectrum disorder, ASD, is typically first identified and diagnosed in young children. Today, the diagnosis and the timelines of diagnosis are getting a little bit better, in that children are being diagnosed as being at risk for ASD much younger now than they were years ago. Early intervention for children with ASD is critical in order to help them progress with their developmental skills and communication. So just to, again, review the 3 major areas that are affected. I mentioned impaired social interaction, and specifically that means the child's ability to actually engage with shared attention with another person, and having an interest in engaging with other people to participate in activities or engage in play together with another person. Obviously, children with ASD have very difficult time developing peer relationships because of the impaired social aspects of the disorder. Children with ASD have very varied verbal abilities, and some children do continue to progress verbal communication skills. and some children then fail to make progress in that area. Um, Also, their nonverbal behavior, meaning their ability to use communication socially, or use their facial expressions, body language, appropriate social skills when they are communicating is often impaired. We also see children with autism have a lack of development in pretend play. And in this module, I do have posted the Westby Play Scale, which I will be also reviewing. And again, we use that play scale to really look at a child's ability to develop symbolic play skills, which would then give us an idea of that child's capacity for using a language as symbols as well. So again, children with autism may demonstrate repetitive movements. They may want to engage in behaviors that are ritualistic. They may be preoccupied with objects or things in an abnormal way, and they're often resistant to change. So when we do talk in more depth about autism, I'll be emphasizing, the elements of using visual scheduling and providing visuals to a child with autism to help them understand what's happening during their day and transition from one event or activity to another. So children with ASD may demonstrate some other types of language behaviors, such as echolalia. And echolalia, again, is a repeat of speech that is spoken by others. And it could be immediate. So if a child hears someone ask them a question, such as, what do you want to drink? They may immediately repeat the question back, what do you want to drink, versus answering the question. And it can be delayed, meaning that later on, after some time has gone by, then they're randomly repeating phrases and spoken language that others have spoken to them at other times during the day. Children with autism can have sensory integration impairments, meaning that they have difficulty processing information in their environment, processing information through either vision, through tactile or touch, or through sound. And they may be very sensitive to those different inputs through either vision, sound, or touch. And there's continues to be a lot of research in this area. Current research indicates that the cause of autism is believed to be neurogenic. Current MRI studies have been conducted to really see that the brains of children with ASD do function differently than normally developing children. Some comments about children with traumatic brain injury. Again, depending on the extent of brain damage, the cases can widely vary, and according to obviously the symptoms or outcome. If the injury is more severe, there may be more diffuse brain damage, and which results in swelling, intracranial pressure. Physicians really try hard to reduce that swelling and pressure, because that, again, causes further brain damage. Children with traumatic brain injury, their symptoms could include lack of inhibition, meaning that these children do not have any kind of filter per se in what they're saying. They may be inappropriate at times. They also may lack initiative, meaning motivation to do things. They may be just very distractible, and they may have very low frustration levels, meaning that they get very frustrated easily. Perseveration, meaning that they may keep repeating things over and over, become obsessive about certain things, and again, perseverate on different issues. Obviously, with young children, there is a potential for more of a fuller recovery. There is still debate and more research going on in the field about the concept of cerebral plasticity. Some research indicates that different areas of the brain can take over different functions with children who are younger. And again, cerebral damage before the age of 2, research indicates that there is more of a chance of cerebral plasticity. And again, research indicates that both hemispheres of the brain have the ability for language acquisition. Left hemisphere still remains more capable of language learning, but there has been some research that other areas of the brain, it's possible before the age of 2, could take over for those skills. Children with specific language impairment, or SLI, can have specific receptive and or expressive language impairments, meaning that there is not any other disorder or diagnosis that would directly impact a child's development of language. And all of those factors have been ruled out. However, the child still continues to demonstrate a language impairment. So then we would then diagnose the child as having a specific language impairment, or SLI, if that were the case. These children often demonstrate vocabulary deficits, and their overall vocabulary can be more limited, and they're relating also to their ability for knowledge of concepts and using language to relay concepts. They may have grammatical deficits, meaning that their use of grammatical morphemes is slow to develop, and their use of more complex sentence structures, such as use of clauses and use of conjunctions in order to have longer sentences, may be more difficult. Also, these children demonstrate difficulty with discourse skills. So that means specifically the ability to tell stories and engage in conversation. Oftentimes when we're engaging socially with others, it usually involves around some sort of story. So these children often have difficulty engaging in that type of skill. And then again, to reiterate and go back to looking at a child's symbolic skills and play abilities, you might see deficits in those areas. They have done some brain studies to show that there are some subtle irregularities in the brain structure or function of children who have been identified with specific language impairment. So it does point to a neurological basis for this type of disorder. There are different public laws that are in place to provide services for children who have been identified as having a disability. And these services here, again, are mandated by these public laws. So the Public Law 94-142 was passed back in 1975, and this mandated that all children who have been identified with a disability are, by law, guaranteed an educational program. And most importantly, in a least restricted environment. So this educational services would start at the age of 5, according to 94-142. However, there was an amendment back in 1986, and that was Public Law 99-457, and that mandated school districts to provide preschool services to children starting at age 3 who have been identified as having a disability and qualify for services at the preschool age. So this resulted in school districts having in developing their preschool handicapped programs or preschool disabled programs throughout the country. And with these public laws, then a IEP is then developed, which is an individualized education program for the child's educational services that they are going to receive. And the IEP is a legal document that follows the public laws. And in the IEP, this specifies the amount and type of special services that the child is going to receive from the school district, and again, that's outlined in the IEP. So that could include therapy services, the type of educational setting, so the type of school and or classroom that the child is going to attend, and the kinds of supports then that the child is going to receive in order to progress with their educational program. Part of Public Law 99-457 also established financial incentives to states to develop early intervention programs. So this is where the development of EI, early intervention, started to evolve. And obviously, EI services can start from birth and then progress until the child is the age of 2 years, 11 months. For children to receive services through early intervention, the infants and toddlers, again, have to demonstrate more global delays in cognitive and speech and language development, and then also possibly physical development. Here to talk about the different types of assessment tools that are used for young children. There could be, again, a combination of norm referenced measures and criterion referenced measures that are used for assessment. And norm referenced measures obviously provide a ranking of a child in reference to a group's performance. So again, you're comparing the child that you're evaluating with then other children of the same age and population. So norm reference measures typically refer to standardized testing. And when we say standardized, meaning that there is a specific standard that needs to be followed in order to administer the test fairly, according then to the normative data that they have obtained for the test. There is particular scoring procedures that need to be followed as well. And these tests demonstrate reliability and validity when the tests have been developed, so they have been tested for that. Norm reference scores or standardized testing is often necessary for eligibility of services in order to determine if a child can in fact receive services or qualify for services in the public school setting. Obviously, they should not be used alone for determining intervention planning. Really, criterion reference measures should also be used as a supplement to your assessment, in addition to informal assessment procedures and language sampling. Criterion reference measures, here we're looking at a child's performance and kind of the degree of mastery of skills that are expected for that child's age. So there is no specific standard score per se with the criterion reference measures, but we are comparing the child that we're evaluating, their skills compared to what's expected with their age according to other peers that are normally developing. And we use criterion reference measures as guidelines. So again, the Westby Play Scale is an example of a criterion referenced measure that we used as an assessment tool for young children. We could also use developmental checklists, and we can use environmental communication inventories, meaning that we're looking at the child's communication skills in their current environments and seeing how successful they are using the particular communication skills in those particular environments. So norm referenced measures used with preschoolers typically consists of sets of subtests within a comprehensive assessment tool. And these subtests measure various aspects of receptive and expressive language. Most include subtests on areas of language content, meaning vocabulary, and form, meaning the child's ability to connect words together using syntax and also using proper morphological endings. Receptive language is often assessed by having the child manipulate different objects or items during the testing according to specific tasks. We may ask the child to point to pictures depicting objects to see if they can identify vocabulary in pictures, and also perform actions with the different objects based upon our instructions during the testing. Expressive language is often assessed by trying to get the child to produce different sentences modeled by the examiner or assessor, and posing different questions or asking the child to complete sentences during the testing tasks, and presenting different stimuli to the child to then get them to produce different areas of expressive language. And oftentimes there is a section to include the parent report of the child's skills at home, and the parent is asked to report again on what they're seeing at home as far as the child's communication skills, and as well as their developmental milestones. So did they progress normally with achieving specific developmental milestones such as crawling, walking, what was their course of language acquisition like as a very young child. So those might be some examples of questions asked from a parent when you're doing an assessment with a preschooler. So the Preschool Language Scale, or PLS, is a very popular assessment tool that fits all of this criteria that I just mentioned, and is a norm reference standardized test that is widely used. When we do the topic on assessment, I did include information about the PLS and a little mini webinar that you can watch about that assessment tool to become a little bit more familiar with that. Some final comments about intervention issues with the young population. And there definitely has been a shift over the last decade from traditional pull-out therapy, which would mean pulling a child out of their environment and then working directly with that child in a more isolated therapy room, to intervention and more natural environments. So actually working with the child in their current environment to work and promote the use of their language skills in the natural environment. So with obviously early intervention, services are either provided in the home or wherever that child spends the majority of their time. It might possibly also be provided at a daycare center if that's where the child does spend the majority of their daytime hours. The ultimate goal of intervention is to really help the child to be a more effective communicator in their natural environments. Young children learn through play, so therapy is typically really evolving and around play activities with the child. That's how young children learn. And again, that's going to be our vehicle for therapy and educational activities. Again, we try to do naturalistic intervention versus direct teaching. Okay, so working again with that child in the natural environment and really working with the current events that are occurring in the natural environment to then foster language acquisition and development within that environment. As I mentioned, for early intervention, home intervention in a natural setting has been determined to be the best to promote generalization of that child's communication skills. So just to then finally mention that children who have been diagnosed with a developmental disability, such as Down syndrome, they may receive speech and language intervention at an early age. So they will automatically qualify for early intervention services because it is known that these children will be at risk for developing speech and language delays. So they will automatically qualify. Other types of developmental disabilities such as cerebral palsy and autism spectrum disorder also fall into that same group and being able to automatically qualify for early intervention services. So this concludes our lecture on young children with language delays, and feel free to ask me any questions over the question and answer forum or through email. Thank you very much. Some final comments about intervention issues with the young population. And there definitely has been a shift over the last decade from traditional pull-out therapy, which would mean pulling a child out of their environment and then working directly with that child in a more isolated therapy room, to intervention and more natural environments. So actually working with the child in their current environment to work and promote the use of their language skills in the natural environment. So with obviously early intervention, services are either provided in the home or wherever that child spends the majority of their time. It might possibly also be provided at a daycare center if that's where the child does spend the majority of their daytime hours. The ultimate goal of intervention is to really help the child to be a more effective communicator in their natural environments. Young children learn through play, So therapy is typically really evolving and around play activities with the child. That's how young children learn. And again, that's going to be our vehicle for therapy and educational activities. Again, we try to do naturalistic intervention versus direct teaching. Okay, so working again with that child in the natural environment and really working with the current events that are occurring in the natural environment to then foster language acquisition and development within that environment. As I mentioned, for early intervention, home intervention in a natural setting has been determined to be the best to promote generalization of that child's communication skills. So just to then finally mention that children who have been diagnosed with a developmental disability, such as Down syndrome, they may receive speech and language intervention at an early age. So they will automatically qualify for early intervention services because it is known that these children will be at risk for developing speech and language delays. So they will automatically qualify. Other types of developmental disabilities such as cerebral palsy and autism spectrum disorder also fall into that same group and being able to automatically qualify for early intervention services. So this concludes our lecture on young children with language delays. And feel free to ask me any questions over the question and answer forum or through email. Thank you very much.